Good afternoon, everyone, and welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the conference over to your moderator, Neil Dreimer, Director at CFHI. Please go ahead.
Thanks so much. Hello and welcome to the Priority Health Innovation Challenge webinar series. My name is Neil Dreimer and I'm so excited to be joining you today as the host of today's webinar. I'd also like to start by acknowledging that we're meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, we acknowledge that we are hosting this webinar from Ottawa, which is the traditional and unceded territory of the Algonquin Nation. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. We also want to acknowledge that this is an unprecedented and difficult time for us as individuals in all our unique contexts, both personally and within our roles in the healthcare system. At CFHI, we continue on our learning journey and the commitment to support improvement with and for all people in Canada. Finally, we want to thank you and acknowledge everything that you're doing in these challenging and unprecedented times. I also wanted to just point out that we are pleased to host all of our activities bilingually, including this webinar. If you wish to view today's slides in French, please let us know in the chat box now. The telephone number to connect to the French audio will be on the screen once you are transferred to the French room. We invite you to use either of our official languages when entering your questions or comments in the chat box. So today we're going to be talking about a very timely topic both to the mandate of CFHI and highly applicable, I'm sure, to the important work you're doing in mental health and home and community care and beyond. Rapid innovations, lessons from the crisis. Before we get started, there are a few housekeeping items I'd like to mention. If you haven't already done so, please do take a moment to introduce yourself using the chat box on the bottom right corner of your screen. Tell us your organization, where you're located, and any burning questions you have for us today. I'll also remind you that at any time throughout the webinar, please feel free to send in your questions using this chat box in either English or French. We have reserved a few minutes at the end of the webinar, but please feel free to pose your questions as we go. So now it's my pleasure to introduce today's speakers. Dr. Jason Geertz is the Director of Research and Leadership Development at the Canadian College of Health Leaders, and he's also a faculty at CFHI. Jason has been presenting on leadership and lessons learned during the pandemic since its onset. I've heard Jason speak already a few times, and today we will be talking about innovation during the pandemic and moving forward. We're also pleased to have Kathleen McQueen join us today. She's the Provincial Leader for Clinical Excellence and Therapy Services at CBI Home Health, one of our home and community care priority health teams. And today we will hear her present on some of her lessons learned from rapid innovations at CBI Home Health. A warm welcome to both Kathleen and Jason. Also want to do a shout out to my colleagues on the Challenges team. I'm sure many of you already know these folks, but warm welcome to Lindsay, Sabrina, and Emily, who you'll find monitoring the chat box and are your go-to people if you have any questions. And I do see the chat box action is lighting up, so great to see that. As for the webinar objectives, we're hoping by the end of today's webinar, since we have many new folks on the line, a warm welcome to you. You'll hear a brief overview of innovations at CFHI and take a look at where we are along our priority health journey. We're also going to have an opportunity here, an exciting new award opportunity for all of you watching today. And obviously, and really excited to hear the unique perspectives of Kathleen and Jason on rapid innovation. So just a quick reminder about the Canadian Foundation for Healthcare Improvement. We're a pan-Canadian healthcare organization funded by Health Canada, and our work is really focused on accelerating healthcare improvement. Finding and promoting innovators and innovations is one of our key goals, and specific to that, the Priority Health Innovation Challenge focuses on finding novel approaches to improving access to mental health and addictions and home and community care services. So participating in the Priority Health Challenge allows you to interact with like-minded teams across Canada. We're also hoping it'll allow you a chance to share and increase the impact you are making on improving access to mental health and home and community care. Teams can join webinars and participate in our award challenges, and we have up to $400,000 in awards available throughout the challenge, which you can use as you choose to support spread and scale of your work. Just a reminder that we have a lot of great supporting organizations who are helping amplify some of the great work you're doing, and you can see them on the slide. And I imagine some of them are also part of today's call. I could see a few folks already that I know, so that's great to see representation there. And just a reminder that if folks have any questions about the challenges, please feel free to reach out to us, and our team will put in our email address in the chat box in case you do have some questions about the challenges. So just reflecting where we are on our journey. So we're over halfway through our Priority Health Innovation Challenge journey, and as I mentioned, a new award is being announced today. In terms of teams, we now have 22 Priority Health teams joining us to highlight the great work and how they're innovating to improve access in mental health and home and community care across Canada. And you can see all those teams on the map in front of you. And we also do want to extend a warm welcome to our new Priority Health Innovation Challenge team. And they're obviously working in the mental health and addiction sector, and a warm welcome to Woodview Mental Health and Autism Services. And their challenge initiative is the Youth Hub, improving awareness of services for youth. So welcome to you. Okay, so before we delve into the presentations today, to help set the tone, we'd like to start off by having a brief chat with Dr. Jason Geertz on today's topic, Rapid Innovation Lessons from the Crisis. So I'll just invite Jason over to the fireside. And so Jason, great to have you here. We know the world has changed quite a bit in the last 3 to 4 months, a very short time span. And of course, so has the healthcare system and how care is being delivered. One of the natural consequences of this has been rapid innovation. So could you paint a picture for us of innovation pre-COVID, what it looked like, and kind of what you have seen changing over the last few months?
Absolutely, and thanks for having me. Thanks to everyone who's tuned in. These times are so incredibly exciting in terms of, for example, just yesterday we learned of 2 new confirmed cases in New Zealand, which seem to be the global success story. And as sad as that is, it reflects the fact that it is just so unpredictable what's happening next, and yet within that there are so many opportunities for innovation and others. So before the pandemic, part of my research and my colleague at CFHI, Dr. Laura Lennox, we focused on change leadership. Laura has a model of leading and sustaining innovation. Some of you may know about implementation science. There were crucial steps that you had to go through in order to successfully introduce innovation within your organization, even on a micro level. And no matter how, in quotation marks, right you were, how brilliant your idea was, and even front page of New England Journal of Medicine, If we didn't do those things, then we know that the likelihood of success was really low. And that was just a reality. We've done CFHI webinars that being right is not enough. The pandemic sets, and then the most obvious massive change was that the traditional excuses for resisting innovation, that may not work here, we're already overwhelmed and swamped with the 75 unread emails in our inbox, that we haven't tested it out, we haven't trialed it, we pilot projects, all those things went right out the window because we didn't have time for them, and the option to say no just was not possible. So I see that we're joined by some CHEO people. One of the best stories I've heard is that CHEO, the chief of staff, was telling me, had a plan to introduce virtual care with a 3-year timeline. And there were many who thought that was quite an ambitious timeline, that with everything else going on, we may not have been able to do it in that time. Enter the pandemic, and over one weekend, a program was designed that may not have been perfect, but was certainly put into place, and 70% at least of the care at CHEO is virtual. So that is remarkable. To go from 3 years to 1 weekend, that is an example that is indicative of the kind of innovation we've seen in health organizations across Canada. And how can we tap into that attitude where saying, I'm sorry, it won't work is not even an option, that we can accelerate the process, tap into the creative and collaborative parts of our brains and our personalities in such a remarkable way. So that's to talk, Neil had asked about what was it like before and now. The old excuses are out. The two other things that we've seen recently is there's been a tremendous trust in frontline caregivers, because there's the command and control language we've used in an emergency that I think is appropriate in some ways. But what we forget is that implies you just follow direct orders. But in fact, in a crisis where the variables and the context is changing every minute, you can't just follow the orders because things have changed. So you don't have time to check. So we have had to, whether it's an emergency department with the docs and nurses and others in long-term care, you have to just trust the people you've hired, hope that we've given you the support and resources you need, and off you go. We will support you in this decision in the moment. We can debrief after, but we've trusted you to use your expertise to innovate in an on-the-spot way rather than in a systemic way, in ways that in peacetime, in quotation marks, are not the way we normally go about things. And then the third part that we've seen that's really groundbreaking is that because we're all globally in this situation where nobody has, even Dr. Bonnie Henry doesn't have all the answers, that we're all doing this together. So there have been coalitions that have evolved, that people, whether it's within, even departments within health organizations or among organizations or between health organizations and community ones, that had never really worked or worked as well before. But we recognize, well, what do we do if we lose 4 PSWs? How are we going to staff this? Well, we're going to be forced to connect with this organization, so that there's a kind of a disaster planning, or in other ways, in more positive language, a possibility or an opportunity planning that has enabled coalitions to develop that, as I said, either hadn't been as well established or were certainly concretized through these experiences.
No, thanks so much, Jason. Yeah, you pointed a great picture of a lot of the benefits and what shifted. I heard trust and collaboration, coalitions, real-time innovations. So lots of tremendous opportunities that have arisen. I guess maybe there's also some trade-offs or things that maybe haven't gone as planned. I wonder if you can just reflect a little bit on what we've given up, or what are some of the trade-offs in it as we're looking to rapidly innovate?
Thanks, Neil. I think that's a great question, and I think it's a question that hardly anybody is talking about. Some of us are very excited about the innovations we've seen, and I think we have a lot of reason to be excited about it, and yet the trade-offs that you mentioned, so for example, for those of us who are super energized by innovation and who thrive in high-pressure environments, I'm one of them for sure. I love rapid innovation. For the process people among us who really like to plan, to organize, to schedule, this way of going about work is incredibly stressful. And when we're doing it in a prolonged period of time, there's real conflicts that can emerge. There's a lot of stress for the individuals. And so beyond just the individuals, the process people, for people like me, come in quite handy because I like to work quite quickly. And at the same time, when checked by the process people about the system and the regulations and all the different steps we normally take, often we do catch things that if you move too quickly, you would have missed. Some of the trade-offs, so going back to the CHIO example, which again is a tribute to them, but also shared by many others. What was it in the 3-year plan? It couldn't be that everything in the 3-year plan didn't need to happen because we could do it in a weekend. So what was in that plan to reflect on that we did trade off? So for example, sometimes it means that we went with a strategy that worked. It's possible that there could have been a better one. When resources need to be acquired, this idea that drives me crazy in my work at the college of RFPs, but it's possible that you could have found a more economical way of pulling it off, which at the time you're desperate so you don't have time for. And then another one, a trade-off, is that when we do it, and I don't mean this in a pejorative way, but let's say the longer way, we tend to involve a heck of a lot more people. We involve more of our colleagues, we involve patients and families and other community members in a way that's really, really, really important. When we do it over the weekend, sometimes we definitely don't have time to include everyone. So whose voices have not been included, which not only means that we've missed out on their wisdom, but we've also potentially missed out on their engagement. And so those are essential parts of change leadership and implementation science that sometimes when we do it really quickly, we miss out on. So the key steps, sometimes there's a pilot project to test it out before we roll it out for everyone. And sometimes we find a lot in the pilot that even if it's a great idea, boy, am I glad that we found these things in the first few months before we implemented across the whole system. So I think, just to summarize, there are some things that are so exciting about what we've done, and it would be a great idea to reflect on those, what could be carried forward, but also what is it that was in the 3-year plan that when we meet somewhere in the middle between the weekend and the 3 years, what is it that really would help, whether it's involving all the other voices, considering alternatives, and then the part I love is the get moving forward.
Thanks so much, Jason. Yeah, I think there's a lot of really important reflections in there, and I know at CFHI, making sure that there's meaningful partnership with patients, caregivers, and families is one of our core values, and I think we've definitely heard lots of examples about where there hasn't been the time to make sure everybody's voices are included, so some really important reflections there. So really, some really good points. Now I'd like to shift gears a bit, and we'll hear from Jason later on in the presentation, so he's not going too far. But I do want to take this opportunity to introduce a new award, which is designed to support teams during this more challenging time. So we're excited to share more information on our new mini challenge number 3. And with that, this new challenge gives you more flexibility in these evolving times. So you now have an option to submit for this mini challenge a choice, either a project charter or an adaptation report. And with that, you'll have a chance to receive one of 10 awards of $5,000, and with the deadline to submit by August 5th. So just speaking a bit more to your options, the project charter is really focused on asking you, and these are definitely some elements of Quality Improvement 101. What are you trying to accomplish? What changes can you make to improve? And also, really critical, how will you sustain and spread your work? And just to note, you cannot resubmit this if you've already submitted a project charter for mini challenge number 2. And if you'd rather focus on something else, well, we're giving you choice. The adaptation report asks about how you have adapted your work during the time of COVID to better serve your population. some specific questions. How are you planning to measure the impact of your adaptation? How are you engaging, partnering with patients and caregivers? What is enabling this work, and what are some of the challenges you are facing? So just a reminder, you have until August 5th to submit that. And for further details, we will be sending out some revised terms in the next day or two with the webinar recording, which will have all the details on this challenge. Feel free to reach out to the Challenges team if you have any questions. And good luck to all of our team. So with that, I'd like to now pass the mic to Kathleen McLean from CBI Home Health, and she'll be sharing some of the lessons their team has learned during doing rapid innovation during the pandemic, and specifically on their caregiver program. So please go ahead, Kathleen, and I believe you'll be moving your slides.
Yes, thanks, Neil. So hi, everyone. My name is Kathleen McLean. I'm the Provincial Leader of Clinical Excellence Therapy Services for CBI Home Health. I'm excited to be here today to describe some of our rapid innovations and lessons learned via our Care for the Caregiver program. Before I begin, I just want to say thank you to the CFHI team and the Priority Health Innovation Challenge. This has been such a positive experience for our team, and during the pandemic, it has really been something that we have looked back on and relied upon to help us continue in our efforts to innovate and support this program for our clients, families, and caregivers. I also just want to mention some of the key discussion points in Jason and Neil's fireside chat. Lots of interesting things there. I'll try to weave them into our discussion and some of the insights that we'd like to share with you. So thank you. Okay, so CBI entered the Priority Health Innovation Challenge with our Care for the Caregiver program, which we call our C4C program. And just to give you a brief overview of this programming, it's a two-stream program for both informal and formal caregivers. However, via the CFHI Challenge, we're focusing on our informal caregiver work. So it's a tiered program where we offer different levels of services for family members and caregivers. So tiered free services is really just an embedded approach to our CBI team supporting caregivers, whether that's offering general wellness tips, self-care resources, embedding education and strategies into the services that we deliver every day, or offering or connecting caregivers to community resources and services. It's really an embedded philosophy that we have put into all of our programming and services. The Tier 2 service offering, our caregiver wellness programming gets a little bit more personalized in terms of customized interventions and care plans. So this is really where, when we're involved in care with a family, that we offer more standardized screening and assessment from the CBI home health provider, and we develop an intervention plan or targeted interventions based on these needs assessment results. Often this includes enabling caregiver safety, facilitating informal peer support, and offering system navigation. And then finally, our more targeted Tier 1 service offerings is really about an expedited referral network. So us acting as sort of a bridge between caregivers being able to access more of that targeted intervention or services, which might look like respite services or family counseling, social work referral, et cetera. So our plan to scale and spread, we were moving along quite nicely with our Care for the Caregiver programming, and we had a large event planned. And this was based on our project charter that we submitted for the mini challenge 2 with the FHI in terms of how to scale and spread our program and really facilitate awareness across our large organization, which is a national organization, but with many teams working in different cities and provinces and often very remotely. So we were planning on hosting a large Care for the Caregiver workshop or day, as I said, to spread awareness, to bring our teams together, to build and support skill development, to collaborate on how we best deliver caregiver services and our Care for the Caregiver program. And finally, really to form a bit of a community caregiving network. So during this day, we had invited a number of community partners and caregiver organizations. CFHI was going to be there to present with us. We had a keynote speaker and lots of community organizations, agencies, home care providers, including ourselves, were all set to attend. And then the pandemic hit. And so unfortunately, we had to cancel our Care for the Caregiver Day, which was really just about a few weeks away. And so, that was a huge challenge for our team. There's many team members that are on the call today from CBI, and we all sort of had our parts to play in that, and a huge amount of work and effort went into really sort of formally launching this program, and so much momentum had been built up. And so this was really, really challenging for us. So what did we do after this sort of event has been canceled, and what has happened next? So it's been surprising, and this ties into some of what Jason and Neil were saying. Trust our team, let them go out there and be committed to delivering, exceptional care, and they will really find a way. It's our job to support them, help them debrief afterwards, but, help them to make some decisions about the care that we're delivering. So our teams remain committed and resilient. There was, a period of time where we were sort of all hands on deck, focused on what we needed to do in the moment, but quickly thereafter, our team members were coming back and saying, can we still offer the caregiving program, programming? What can we do to offer it in an innovative or different way? And so that was really heartwarming, that our teams were still committed to the cause. Our caregiver screens and interventions actually increased. So they were either sustainable or increased, which was really interesting over the past 3 or 4 months. And so that was sort of an early indicator that, we did have that commitment from teams, and that this care was really important to be delivered during the pandemic, and that we had to look at some options to continue to support the programming and to pivot. We had leaders within our organization reach out to us to see if they could support the C4C programming. So this was really refreshing too, because these were the leaders, the stakeholders within the company that if they're on board, they can really support the scale and spread of the programming. A key thing for us was our funders recognized the importance of caregiver services and support. So during the pandemic, there was a real sort of movement towards checking in on our caregivers, really recognizing that they take on the bulk of the family care. But what does it look like for them now with these increased stressors and unprecedented challenges and conditions? So that was also really refreshing for us and motivating to see, sort of that permission given to reach out to caregivers, not to just focus on the person or the individual, always to really take a person and family-centered approach. And then lots of collaboration has gone on over the past few months. Just talking about how we continue to scale and spread, how we can pivot, how we can innovate. And so that has really brought new team members together and existing team members together in ways that we maybe didn't suspect. One of our key things that we did during this time was we really involved our caregiver partner that is on our CFHI team. And he came in and spoke to our team members, and nothing is more motivating or grounding than hearing from a caregiver partner or a patient partner who can really tell you what you're doing right and really tell you what you're doing wrong. And so that was another key thing that we did during this time. So finally, and one of the more exciting pieces of how we sort of pivoted during this time is something that Jason mentioned as well. So CBI Home Health transitioned to virtual care in a matter of a week. And we too had a roadmap that looked more like 2 or 3 years. And over a week, we all came on board to virtual care. And it certainly has not been easy, as they mentioned in the fireside chat. Lots of challenges. We haven't got it perfect. As we have more time to reflect, maybe there were some things that were missed. However, there's also that key messaging that Jason, I think that you said, let's get moving forward. And so really our ability to be able to pivot and implement virtual care has given us a pathway to move forward and to look towards the positive. And then our most exciting innovation, I think, is a bit of a new service delivery model that we have embarked on since the pandemic, and is directly related to our care for the caregiver programming. So we ended up partnering with the graduating class of OT students at Western University to help them graduate, because they were supposed to be on their final level placements this summer, and you know, wrapping things up and graduating and then entering their career as an OT. And with the pandemic, all of that sort of came to a halt. And so we really looked towards our teams to say, can we facilitate them graduating? Can we offer them a virtual placement? How can they support us and our clients and our families, and how can we support them? A really true partnership during this time, which, you know, is just, as we said, we're facing unprecedented challenges that we've not done before. And so we brought on board the full class of the OT students, and we have them actively delivering our care for the caregiver programming to our caregivers across CBI. So we were actually able to make that leap to scaling and spreading it across the organization. And we have our students learning about caregivers every day and, you know, reporting that information back to us, which is such an interesting opportunity for us to learn what caregivers look like in different cities, in different provinces, and with different cohorts. And it really gives a chance for our class of OT students to develop their skills, learn about caregivers themselves, and we're so hopeful that they take that into the future, that they're a bit of a jumping board for this programming, you know, moving on in ways that we could never really have envisioned, because we think they will take it forward into whatever setting that they work in. So lessons learned. There's always a way, and I think, you know, we hear about that often, and as Jason said, for those of us that like to sort of innovate under these types of conditions, there is always a way, and so that's a positive. And when you can involve your team and collaborate, you definitely find several ways to move forward. Innovation isn't always about technology, so it's often about human necessity, and we certainly saw that with this sort of innovation for our programming. There was the technology piece for sure that has enabled the care to be delivered, but it was really about the human necessity and thinking about what caregivers were going through, what was going on in the home environment, and how could we reach out and continue to be that connection. Iteration is a key ingredient to innovation, so you know, I don't think that ever stops. I think that's a key lesson. We need to keep moving and iterating, and in that sense, we'll continue to be successful. Life and the delivery of care, as we know it, has changed, and so, as you said, Jason and Neil, sort of all of those barriers kind of faded away quite quickly, and maybe we're dealing with a new set of barriers now, but it's nice to sort of change direction from some of those reasonings we would hear, that it was hard to innovate or it's hard to introduce a pilot, and now we're sort of moving in a new direction. And then finally, you know, relationships and partnerships are key. So that's really what we learned with the UWO class. You know, there are new team members out there that are just waiting to be leveraged or to join the team. Collaboration and coalitions can really expedite innovation and our ability to offer enhanced programming and accessibility. So that has been a huge lesson for us, and we hope to continue to explore that. So yeah, I wanted to say thank you again for letting me have the opportunity to share some of our lessons that we've learned and some of our insights with this group.
Thank you so much, Kathleen. I think you know, what you shared and what you been able to achieve as you rapidly innovated on so many different levels, including your care for the caregiver program. I think there's a lot in there that we could all take back to our own settings, regardless of where we work. So I'm sure you guys do have some questions for Kathleen. We do have a Q&A session at the end of the webinar, so I'd suggest that you chat in your questions now and we can go back to them, or we can come to you later on, but feel free to chat them in. And and we'll get to them later on in the webinar. And before we do that, or before we move on to hear back from Jason, I did want to pull up the poll that we started at the top of the webinar that I think people have continued to add in, and just reflecting on what we've heard here. What are lessons that you have learned from the pandemic? And I know there's some key ones, and engagement, including lots of different people, obviously patients and families, but also physicians. Some of the themes around preparedness. Some are more prepared than others, and that could obviously impact your ability to pivot quickly. How adaptable folks and teams and services have been. We've heard so many examples of going remote in so many different aspects, not without its bumps along the way, but it's amazing how quickly things have changed, and obviously the importance of seniors care and supporting caregivers. Some other reflections on what are some of the innovations that have come forth since the pandemic. So, I mean, just glancing at this list, I see virtual care over and over again, use of technology. Pretty much everything has gone virtual out of necessity, or I shouldn't say everything, but a lot of things. And again, hasn't been perfect, but I think that's the most obvious theme here: virtual care visits and activities for clients, doing virtual support groups. Some of the other themes that have come up, innovations related to infection prevention and control. So there's definitely some themes, and maybe something to consider as we move on back to Jason and hearing a little bit more from him. So I think we'll go back to the slides now, and we're just waiting for the slides to come back, and I will just move it back to Jason, who's going to talk a little bit more about time for innovation. And Jason, I think you're moving your slide.
I am indeed, yes. Thanks very much, Neil. And thank you to all of you who contributed to the poll. I've taken notes on it, and we'll try on the fly to incorporate it as we go through. So essentially, at the college, we've now developed a model of 4 stages in a crisis. And the very quick backstory was that I was invited by an organization to talk about leadership in a crisis, but what we meant was in the emergency stage. And then the night before, I got a sense from walking around central Ottawa, from watching the news, that many of us had actually moved on to what now we have called stage 3, where most of us, I would wager, are now. And so I started my presentation and said, where are you? And the audience was almost equally split. There were some people who were still in high emergency, and others who were in this kind of awkward limbo stage. And so our model starts the escalation part. Most parts of the world are not in that stage anymore. There are some, Turkey, for example, India, they are absolutely in the first wave of this. Then most of the world, I would wager, is in this stage 3, where it's not finished for sure. And again, unfortunately, New Zealand seemed like we were there, and now we're back. And so we're not finished. If we're not in the emergency stage, where are we? We're in this stage 3. And I got really excited about this early on because nobody was really talking about it. We had seen crises before, and many of us have been prepared for how to deal in an emergency, and we know what it's like after an emergency of how we go about things. But not many people were talking about stage 3, and so that became a big part of our research. So on the right, you have a document that's available on the college website. It's available to everyone, and that summarized basically effective leadership in the emergency phase of a crisis. And the part I want to highlight for today that I've already mentioned in the fireside chat is part of it is you have to equip the frontline people with the resources that they need and just enable them to do their jobs and to use their brains in a creative way. And trust, as we said, Neil highlighted this. I think just about, if you were to summarize leadership in a crisis in one word, trust had better be one of the top considerations, because we need to be able to trust that our senior leaders are acting with our best interests and the best, based on the best evidence that's available. And likewise, if we're on the front lines or we're doing the work, we need them to trust us to do our jobs and to be supported. So I wanted to highlight that innovation really hinges on this one of the 10 factors here of leadership in a crisis. So just, we don't have time for a discussion right now, but basically in your organization where you work, to what extent or what brilliant examples have you seen where you've felt or you've seen that the organization has trusted and equipped the point of care people or wherever you are? And how have you felt that personally? And then, of course, the next step is how can we keep that going? So essentially, in terms of, I'm just going to give a very brief summary of some of the characteristics of this stage 3. And basically, I think because we've moved out of stage 2, where some of us have seen loss directly, some of us had confirmed cases at our facilities, but even if we didn't, it's been tough in the last few months for lots of us. I saw in the polls the working from home has been really difficult for lots of people. So number one, to just take a pause to say there's been loss. There's been loss of our loved ones. I cannot even imagine what it's like to lose a loved one and to not get to go to the funeral, for example. Even if it's not that kind of loss, there's been a toll on our mental health that many of you are intimately aware of and deal with day to day. There's been financial loss. So just taking a pause, recognizing it would be a mistake to bypass this, especially for ourselves, but especially with those with whom we work. So the risk of burnout was quite high in healthcare before this happened, and now we've lumped on these extra responsibilities. So what as leaders and as practitioners need to do is make sure that there is that psychologically safe space to process and to heal. So who needs to debrief out loud? In a group setting so we can share. We've done that in Ottawa with the chiefs of staff of all the big hospitals, and it was amazing just to hear them open up and say, you know what, they're very competent, very, very professional, wonderful people, and just say this has been very difficult, and it's nice to share. Who needs a one-on-one talk? Who needs a buddy? Who needs a break? I remember, I won't mention the name, but the CEO of a big academic center in Toronto apologized for not getting back to my email because he said, I was on vacation. It killed me not to be at the hospital, but I know that this is what our leaders need, and I had to role model that behavior. That's really difficult, but we can't keep this level of sustained tension going indefinitely, especially since who knows what's going to happen next week. So who needs a break? This is not my area to determine yes or no, but there are people who will need counseling to process what's happening. And then, of course, as I've alluded to, how are you doing? And I think the leaders are so wonderfully committed to their teams and their organizations and their patients and families that the you part is often left out. And there's a human element to this from me to you. I care about you, but also we need you. And nobody is able to sustain this indefinitely. So the safety and the wellness check-ins, the formal ones, but the informal ones, who are the people on your teams who have great emotional intelligence, who can feed you the information you can ask directly, but also to have those people who can say, hey, I think the team stress is really high. We need something tomorrow to lighten it up. The second thing, and one of the people in the poll mentioned this, that some of us had 3-year strat plans or 5-year strat plans 6 months ago. To a large extent, that went out the window in March. And so now we have a chance to recalibrate and say, as we said, like, what are the top priorities right now? To what extent do those relate to the longer plan that we had before, knowing that the pivoting that we've heard many times, it could go forward wonderfully. We may have to go back. So what is it that we really need to be prioritizing and make sure that we communicate that very clearly? Because one of the sources of greatest anxiety right now is when people feel they don't know what's going on. Very helpful to have the Prime Minister on TV every day. We know with regularity this is what's coming. Even if there's not that much that's brand new, at least we don't worry that really big things are happening and we're left in the dark. The other thing that's a real factor in health, as you know, as well as I, that the reintroduction of non-essential services. So whether you work in a hospital, all the elective surgery. So imagine someone who needed a hip replacement 4 months ago has been on hold. What has that experience been like? So from the patient's point of view, from the caregivers who are dealing with, many have expressed guilt at not being able to get to cancer treatment, for example, and then also the management of adding more at a time when things are already quite tense and quite busy. So this is something where we need some time of reflection to say, how can we do this without everybody getting burnt out? And then this idea we heard about working from home. So some of us have been quite used to this. Even if we're used to it, we may not have been used to it with lots of kids running around and 2 different people on virtual calls at the same time, and how do you navigate that? And we heard as well, I talked about the driver people like me, the process people who like the scheduling. There's also the social people, and again, these aren't strict buckets, but the people who at work, they really thrive off the interactions in and out every day of seeing their colleagues. This has been really, really tough on them. So now we've all done it because we've had to we haven't all. Most of us have had some alteration to how we've done it. Some of it includes working from home. Some have loved it. Some are surprised they liked it not having to commute 2 hours every day, for example. Some have liked it more, and some cannot wait to get back to the office. And I use that term in quotation marks. I recognize not everybody works in those. So how do we optimize the balance of where are we on what was it like 6 months ago? What has it been like in the last 4 months? Where do we meet in the middle? And then what else do we need to put in place? So for example, if your entire team works from home, you probably operate in terms of when you meet as a group in a slightly different way than if your entire team is in the office. And so what do we need? And then the training relates to, I had imagined when I created the slide for the leaders and managers, what kind of training do we need for leading, engaging remote teams, providing virtual care, for example, in a different way? So some of the docs and nurses have loved providing virtual care. Some of them, including my father, who's a respirologist, he's doing phone consults. He absolutely cannot wait till we can go back to more of the face-to-face. So there are people like that, too, who aren't just grumpy. They really prefer the in-person stuff. So how do we navigate that space? And so in terms of, well, what are the next steps? Well, we've had some innovation. Now we're talking about next steps and looking forward. And I'm just going to I'm going to go back to that previous slide, but I want to do this one first. To start, first of all, I think other than some people who desperately need a break, the first starting point is to take a second to recognize what we have done that has been brilliant. So this has been tough. We haven't given up. We've stuck together. We haven't turned on each other, with the exception of some pretty aggressive races for toilet paper in the first few weeks of this. But overall, we've supported each other, and we hear that over and over again. We've heard it from Kathleen. We've heard it from others. So let's just take a step back and recognize, you know what? We have done remarkable things together, and that's amazing. So what is the messaging that can keep that going so that we don't sort of devolve into, it's so difficult, it's quite ambiguous, we're not sure where things are going, and that swirl that only complicates things. What can we focus on? Says, we've done great, we've done this, and then now let's keep it going in certain ways. So to go back, the innovations that we've heard from Kathleen, from me, and others, there's some that we've done ourselves, so experience. We have done this at our place, and it worked amazingly. I think it's time as well not to dwell on the negative and not to find people to blame. There are some things in which did not go particularly well, and whether it's because of a second wave that's pending or just moving forward as an organization, I think we need to identify it and say, look, we need to be better at this. So maybe in February we didn't have as much of a heads up, we hadn't prepared quite as well as we'd like. We have the time now to honestly, through introspection and dialogue, to look back at how we did and say, what are some things that we need to agree on that need to be better? And provide the training so that we know that no matter what happens, a second wave or just regular life, we are better off than we were in February, for example. And then thirdly, this is a time where as a global community, we have all been through this together. So SARS-1, for example, there were many people whose day-to-day lives actually didn't change that much. This is completely different. And we have natural experiments going on all over Canada and the world where we can look to and say, what did they do that worked really well, and how can we introduce this? Dr. David Naylor's attitude that he combats against the not invented here syndrome, that we're not open to ideas that we haven't done at our, that's got to go out the window. What are the best examples of best practice in organizations similar to ours that we can pilot, introduce, learn from? This is the time right now. And what's been amazing about this pandemic is that for once in my lifetime, everyone across the world, for the most part, has listened to the experts. You hear politicians all the time say, well, I'm not a physician. I'm not front. Thank goodness you're acknowledging that, and that we are trusting the Bonnie Henrys of the world, so that although we don't have all the answers, this is our best shot at it. And again, some of you know me well enough to know I always bring up, if only the climate change people could get everybody in the world to listen to the experts, we'd be better off. So what have we done or seen that's been amazing, and how do we sustain that, keeping in mind, as Neil prompted me to mention, some of the trade-offs? So how do we sustain the amazing things that we've done while still creating space to follow the key processes or elements of the longer plan that are quite helpful? What have we learned about leading innovation? The openness to it, the collaboration that we've seen, the partnerships, as Kathleen mentioned, that we've developed. How can we keep that going? There is a space, even for people like me, to trial things. And as importantly, whether as leaders or people who support them, how can we support innovation? Because that's part of a cultural thing. It involves resources, but these are all parts of a conversation that I'm suggesting needs to happen now. I think one of the characteristics of stage 3 is that we can just try to wait it out until this is all over. And without being a fearmonger, I think we're going to be in some variation of stage 3 for a really long time. And so now is the time. I know that some of our colleagues from Sunnybrook, I know Dr. Smith and I spoke recently at TOH as well. They're deciding right now, how can we, the terms they use are things like reimagine, create, and thrive in the COVID-19 world, not once it's all over, because we don't really know when that's going to be. So this is what I get so excited about, because we've done so much. There's so much potential. How can we keep that going? And so we've also talked about how communication is absolutely essential during the pandemic, and I mentioned already the Prime Minister, Dr. Henry, and others, that it's very important to make sure that we are providing that for our staff, because it's quite unsettling. And Neil uses the word that I've tried to avoid, unprecedented, but this really is a novel thing for all of us. And so we need the reliability and the trust of the communication that comes from not only senior leaders, but point of care leaders, and from us to our colleagues about how we're going to do all this. So how are we going to make sure that the mental health of our team and those for whom we care is addressed? What are the priorities and the strategy right now, even if they may change next week, because the world may change next week? How are we going to slowly introduce or quickly reintroduce the non-essential things? How are we going to find that amazing balance between the people who want to be back in the office and the people who want to stay at home? And how are we going to maximize the opportunities that we have done while celebrating those fantastic things that we have all done by working together? So basically, this is a bunch of questions, and probably some of you would like the answers, but I'm sure that you have the answers once you connect with those with whom you work, because I think we've got so much at our disposal that can fuel those discussions and those innovations. So moving forward, just as my last summary slide, to reflect on personally as leaders, but also as an organization, as a team, what have we done that was amazing? What innovations have we seen that are either so much faster or that we had never even imagined before? How can we keep that going? And to what extent with virtual care should we versus in person? And then some of the collaborations that we've seen. So these are just such wonderful opportunities. And so with that, I just will thank you very much for your time and welcome Neil back into the conversation, and I imagine Kathleen as well, while we address the questions that you may have.
Thanks so much, Jason. I was trying to take some notes of all the things that you were saying, and I stopped because it was just too hard, but I think you really reflected so many of those critical elements that we have to consider. But But I guess one question, and I think it applies maybe to both Kathleen and to your presentation, and I would encourage anybody, if you want to chat in your questions, feel free to do so. I guess, how do we take what has happened, and then maybe Kathleen, we can start with you, and how do we look at translating this into the future? How do we sustain the innovations and the rapid changes that you've made, and how do you keep them going?
Yeah, that's an interesting question. I'm not sure I have all the answers to that, but I think perhaps some of the changes we have made have changed the environment or the culture, so that we need to continue to explore new and different options. And in particular, like Jason said, keep moving forward. You know, if we've had some success with partnerships, continue to look in that direction. And you know, if motivating people with that human necessity has been a really effective thing for us, you know, then look for opportunities to continue to do that. And that comes through the patient or caregiver partners, or really helping people reflect on, you know, as we were saying, what's going on in the world right now. It's very different, and that's a very powerful message. And so, you know, we have to reflect what's going on in the world and do something differently ourselves. The other thing that I think will be really particularly helpful for us in terms of sustainability is those leaders and those key stakeholders and team members that have reached out and you know, demonstrated a commitment and an interest to continue to use them as champions, and continue to pull them into conversations, and assist with problem solving, and maybe having some independence in terms of what the programming looks like at their site, because I think they're going to be the ones that continue to drive it forward.
Thanks, Kathleen. Jason, I don't know if you want to weigh in. I mean, you talked about it, the sustaining and taking the best of what we're seeing.
Sure, and I think the example I use is our own organization at the college. We're a relatively small organization, but we've got a big member base. We've had our CEO and our VPs have a conversation with us that says, yeah, what did you love about the last 4 months, and what are you looking to get back to? And there has been a real openness for someone like me, for example. I much prefer working from home a lot of the time. I felt there's been a lot of trust where there's been no micromanagement on us. We've been trusted to do our jobs, and in my case, most of how I've spent the last 4 months is researching and sharing about leadership in a crisis, and that's what I've trained my whole career to do. And so one of the comments in the poll box was about the priorities, and that some of the things that we used to have to do at meetings, we used to have to go to, that may not have been a top priority, have been put on pause while we do what really are our priorities. So the conversation of what have we seen that should be carried forward, with the promise that we're actually going to factor this into how we create the work environment moving forward. I think that would be my recommendation, because I used our organization as an example, but we've heard that across the country of how people are going about it.
Thanks so much. And I recognize Nadine Henningsen has sort of asked a similar question: what would be the best approach to ensuring sustainability? So of the new innovations, I think you touched on it. I do recognize we are at time, so a really warm thank you to Jason and Kathleen for the presentation. I did want to reflect that our next webinar is September 17th at noon Eastern Standard Time on increasing access to care, the big picture. If you have any additional questions that come through after this presentation, feel free to send them our way. Our email address is in the chat box. So once again, a special thank you to our presenters today. Thank you to the team working behind the scenes on this webinar and many others at CFHI to making this a success. And of course, thanks to all of you for taking time out of your day to listen in. And we just want to ask that before you leave, you take a few moments to complete the feedback polls on your screen, as they will be helpful in planning our upcoming award and webinar opportunities. Once again, thanks everybody, and have a great day.
This concludes today's conference. Thank you for your participation. You may now disconnect.